Here's my audience. My name is Jocelyn Shelton, and today I'll be talking to you about the disease schizophrenia and the effects that it has on people. If you've ever seen the movie A Beautiful Mind, it's the perfect example of the brain disorder, schizophrenia. As a nursing major, I have experienced a schizophrenic patient, and I've witnessed behavioral circumstances, and it causes great concern. I care about this topic because it is a great concern for our society and for our population to care for those who are not able to care for themselves based on their mental illness. To help people better understand schizophrenia, I'll be covering 4 topics: the definition, signs and symptoms, causes, and risk factors. The first step in understanding people with schizophrenia is being informed on the disease itself. As stated by Thomas in his article titled Schizophrenia, schizophrenia is a chronic, severe, and disabling brain disorder that has affected people throughout history. And as stated by Harms in his article on schizophrenia, schizophrenia is a group of severe brain disorders in which people interpret reality abnormally. Schizophrenia is an incurable disease. It will often require lifelong treatment. It has not yet been determined whether the disease is degenerative or not. Degenerative basically means that the disease will get progressively worse over time. And with this disease, physically there's no evidence that it's degenerative. Although these people may require lifelong treatment, they are still able to lead a successful life. In some situations, these people may not be able to hold a job or care for themselves. Schizophrenic behavior can be very similar to that displayed in the movie A Beautiful Mind. These people often hear voices in their head. They think that people are able to read their minds. They can become very agitated because they have an altered idea of reality, and may become agitated with others when they do not understand what they are talking about. They also may not make sense because they have an altered idea of reality, and they may seem normal until they start to talk about what they are actually thinking and informing you about what is going on in their head. As opposed to what people often think, people with schizophrenia do not have multiple personalities. Schizophrenia means split mind, according to Harms, but what they actually mean by split mind is the disruption of the balance of the mind in their thinking processes. There are also different types of schizophrenia, according to Harms' article. There is paranoid schizophrenia, which is that they lose touch with reality and hear things that aren't real. Catatonic schizophrenia, which would be symptoms polar opposite from each other. One day they might be dazed and unable to talk, and another day they might be hyperactive. Disorganized schizophrenia, their speech and behavior is inappropriate and doesn't make sense. And childhood schizophrenia, the same as adult schizophrenia but occurs earlier in life. So the next question is, what are the signs and symptoms of schizophrenia? Schizophrenia symptoms are often categorized into 3 subjects: positive symptoms, negative symptoms, and cognitive symptoms. Positive symptoms are delusions, which is that they see things that aren't real and don't ever stop believing what they see. Hallucinations, which they hear, see, or smell things that aren't real and no one else can hear, see, or smell these things. They have a thought disorder, which is disorganized thinking, and disordered behavior. The negative symptoms are trouble performing their daily activities. They give off the flat effect and their emotions are very dull. They have trouble planning activities. They do not keep up with their personal hygiene. They experience withdrawal symptoms, and they have decreased motivation. Now third, cognitive symptoms are that they have trouble making sense of logical information, it is difficult for them to pay attention, and they have problems with their working memory. It is apparent that a lot of signs and symptoms make it clear that there is a complication with the brain function. So now we will discuss the causes for this disease. Although schizophrenia has no specific cause, it seems to be linked to a problem that is naturally occurring with brain chemicals. Schizophrenia can affect men, women, among different racial groups from ages 16 to 30. It has no specific, it can affect anyone. Ultimately, it affects about 1% of the population. It usually doesn't affect anyone over the age of 45. Schizophrenia not only affects the patient who has it, it affects their families as well. Organizations such as the International Schizophrenia Foundation and the Dana Foundation support people with schizophrenia, but we can lend a helping hand too by donating and volunteering to these organizations. After evaluating some of the causes, it is important to think about some of the risk factors in contracting this brain disorder. Even though schizophrenia has no specific cause, there are some risk factors that can increase a person's chance in contracting this brain disorder. Having a family history of schizophrenia, exposure to viruses in the womb, increased stress, increased paternal age, and taking psychoactive drugs during adolescence. Looking at these four components of the disease, it is apparent that schizophrenic people have a chance to actually be successful even though they have a lifelong disease. It is important to remember that even though schizophrenic people have a life-altering brain disorder, they are still able to lead a successful life contrary to what most people believe. It is also important that as a community we support these people who have trouble supporting themselves. Ways that we can do that is by volunteering and donating. Thank you.